experience for the kids and parents. The media portrays everything as such a rush rather than having it rushed and substandard service. We would encourage the health centers to provide composite care with the screening, health teaching, vaccine prep, administration, post immunization, and documentation and assurance. Pediatrics does take a bit more time, and the clinic setup should be tailored to this age groups. And keeping in mind that some clinics have only 1 or 2 vaccine administrators to provide service. With that, I'd like to hand it over to our first presenter, Joanne Bryant, who will be presenting the first few sections of the presentation. Thank you.
Thank you, Carrie. I'll move on to the next slide here. So there's going to be a lot to cover this morning in terms of the differences between the pediatric Pfizer vaccine and what we're currently using. And what we're going to cover today is, of course, the pediatric 5 to 11-year-old Comirnaty vaccine. We do know that the vaccine was approved last week, and we're going to let you know more about the vaccine and who is qualified to be providing this vaccine, who will be it is indicated for, of course, the 5 to 11-year-olds, what this vaccine, the components are, how effective the vaccine is, if we can administer this vaccine with other vaccinations, other products, how to store and handle this vaccine, how to prepare it and administer it, as well as the common reactions following this vaccine, how to document this vaccine, and a review of the reporting of the adverse events following immunization, and tips on how to immunize children, because it does take a little bit more time, as Carrie said, and passing along some of our expertise and just knowledge for others who haven't had that experience yet. Next slide, please. So we know that the vaccine was approved on Friday, November 19th. Those who can be qualified to immunize are registered nurses who are already providing childhood immunizations. And after the completion of this training module, we also want you to become familiar with the medical directive and clinical protocol in the administration of the COVID-19 vaccines for Indigenous Services Canada or for the Northern Intertribal Health Authority, which have been shared yesterday. For those that are non-traditional immunizers, the licensed practical nurses and other registered nurses who have not experienced immunizing children, after completion of this training, as well as review of the medical directive and completion of a supervised checklist for the COVID-19 vaccine for the ages 5 to 11 years of age. After that is done, you will be checked off and be able to provide this vaccine. So the vaccine is Comirnaty Pfizer BioNTech. Oh, next slide, please. Comirnaty Pfizer BioNTech COVID-19 vaccine for the ages 5 to 11 years of age. The Pfizer vaccine is synthesized in vitro in the form of a messenger RNA or mRNA and is encased in a lipid envelope. The lipid envelope allows the piece of the mRNA to pass through the outer cell membranes where it can be read and expressed in the form of a protein, the spike antigen, on the cell membrane. The immune system of the host recognizes the spike protein and activates both the cell-mediated antibodies and the humoral T-cell immune responses. mRNA vaccines are not live vaccines and cannot cause infection in the host. So they will not give you COVID-19. They also cannot alter a person's DNA because the spike protein does not enter the nucleus. Our cells will break down the mRNA and get rid of it within a few days after vaccination. Next slide, please. So the Comirnaty COVID-19 mRNA vaccine is indicated for active immunization to prevent coronavirus disease 2019, COVID-19, caused by severe acute respiratory syndrome, coronavirus 2, or is referred to as SARS-CoV-2, in individuals 5 years of age to 11 years of age. The Comirnaty for 5 to 11 years old is not interchangeable with the adult vaccine. Adult vaccine, the Pfizer 12 plus, cannot be given to children 5 to 11 years of age. So one thing to note is if a child is 11 and they turn 12, they would be getting the adult version. But if I am seeing a child today who is 11 and in 8 weeks they are still 11, they would be getting the 0.2 mil doses. So you'll always want to look at the time that, or the age of the child when they present for immunization. So that will be one thing to kind of keep in mind as we are moving forward with this vaccine. Next slide, please. The Comirnaty 5 to 11 Pfizer vaccine is 5 micrograms of the nucleoside modified messenger RNA, and it has been encoded with the viral spike glycoprotein of the SARS-CoV-2. It contains lipids and salts, stabilizers, and sugar. So what we know is that the lipids will help the vaccine enter the cells, and it also provides some structural integrity to the nanoparticles of the vaccine. Salts are added to help with the pH of the vaccine. And with this Pfizer vaccine, there is a new stabilizer, which is called tris, or it contains the tromethamine. And tromethamine helps maintain the pH of vaccines, which therefore will help extend the shelf life at warmer temperatures. So this vaccine can be stored at a longer time out at room temperature than the 12 plus Pfizer vaccine. This tris stabilizer is also in our Moderna vaccine that we have been using. Tromethamine is found in some medications such as contrast media, as well as other medications and some creams and lotion. So the European Academy of Allergy and Clinical Immunology has stated that unless there is a history of allergic reaction to any component of the COVID-19 vaccine, there is no contraindication to their administration. So an individual would need to know if they've had a previous reaction, then we would not provide this vaccine. So we'll go through that later in the presentation as well. Next slide, please. So with studies, Pfizer has indicated that a 5 to 11-year-old vaccine has a very good immune response when the 2 doses are provided. It can have up to the 91% effectiveness in the clinical trials, and there was no serious adverse events related to the vaccine. This morning, I had sent out a memo that we are now recommending all COVID-19 vaccines have an 8-week interval between dose 1 and dose 2. What NACI has found when they did reviews of the clinical trial data is that from the real world use of the vaccine, they have found that there has been a stronger immune response when you are providing the vaccine at longer intervals. So therefore, they're going to have higher vaccine effectiveness and it is expected to last longer. And it may also be associated with a lower risk of myocarditis or pericarditis in adolescents and young adults. Individuals may choose to get their second dose using the minimum spacing that the companies have been advising us, which is for Pfizer vaccines, it's 21 days, and Moderna, it's 28 days. But we should first have a discussion with the parents, the clients, about why it's beneficial to wait the 8 weeks between dose 1 and 2, so that they can make their informed decision, which, if they want to get the vaccine earlier than what is recommended. Next slide, please. Health Canada has approved COVID-19 vaccines can be administered at the same time as other vaccines. So we do not have to have an interval between routine vaccines and the COVID-19 vaccine for the 5 to 11-year age group. Next slide, please. So vaccines all need to have their cold chain maintained right from the manufacturer, the distributor, the depot, the immunization clinic, and the vaccine provider. So the work standard for vaccine storage and handling and cold chain break procedures have been sent out to nurse managers, as well as they are available in the COVID-19 online manual, and they will be able to be accessed as well in the Indigenous Services Google Drive. Next slide, please. So transportation of this vaccine, because of that new stabilizer, the tromethamine, the vaccine can be stored in 2 different ways as opposed to the other vaccines that we have. Full cartons of undiluted vials may be transported in that ultra frozen temperature of -90 to -60, or full cartons or individual undiluted vials may be transported and stored at 2 to 8 degrees. They are not able to be stored in the -15 to -20 degree freezer. So that's one difference between this vaccine. So either a full tray or carton or individual undiluted vials are permitted to be transported in a thawed state. The vaccine can be placed from the ultra-low freezer, or if it's been thawed, into a vaccine insulated cooler bag, which we normally would use to transport to the 2 to 8 degrees. We want to record the date and time when the vaccine is removed from the freezer. And if we are transporting just individual doses less than what is in the carton, which is 10 doses in a carton, we would use those foam inserts that we normally use for the Pfizer vaccine. So when we are transporting, we need to make sure that the container can maintain the vaccine temperature between 2 to 8 degrees. And then once it reaches its destination, that it is put in the vaccine fridge and it is not refrozen. Just gotta find my notes here, sorry. It is acceptable to transport the vaccine while thawing during transport, although it is recommended, if possible, to use a data logger, because the data logger can be have a temperature set between 2 and 8. But if the data logger is not available, we can use the min-max thermometer. But it is important to reset that min-max thermometer just prior to transport when we are shipping it out. So just the same that we use for our 12+ Pfizer vaccine, the 5 to 11-year-old vaccine should be handled with care and protected as much as possible from shocks, drops, vibrations. Ground transport should be conducted on paved or smooth gravel dirt roads. Forest or gravel roads are generally not suitable for transporting this vaccine. And this is only for the pediatric 5 to 11 vaccine, that there is no limit on the transportation time like the other vaccines we have, but as long as the transportation time is approved within the approved expiry date and temperature. So the approved expiry date, once it is brought to the 2 to 8 degrees, is 10 days. So we'll go through a lot of that again later on. And here's something to note as well, is when we're transporting it thawed, so if we're removing it right from the freezer into the cooler bag, the temperature may be lower than 2 degrees initially, and then there'll be a stabilization. So if the temperature is under 2 degrees when it reaches the destination, this must be reported as a cold chain break so that we can distinguish the efficacy of the vaccine. So that will be when we need to fill out those cold chain break forms. So that is just when it's under the 2 to 8 degrees, when it's in the thawing state. The vaccine in the thawing state can be transported in that 2 to 8 degrees. And if we're going to use it right when it gets to the clinic, we need to allow that vaccine to thaw for an additional 30 minutes, depending on the transport time. So there's a lot of different things to consider between this. So we'll have to review this at a different date, especially for anyone who is the distribution hub. So the cold chain break, of course, whenever we find any vaccine that is outside of the recommended storage, we want to isolate that vaccine. You want to take it, and if possible, make sure that you're putting it in a plastic bag or putting it in a different bag and labeled "Do not use cold chain break," making sure you're writing the date and the time that you discovered that cold chain break. We should not be using that vaccine until we get direction from the Ministry of Health. Once we get the report, which is available online or at each clinic, you should have the cold chain break report forms. Make sure that you are following your current practice by either sending it directly to your nursing supervisor or your manager, and then they forward it on to the Ministry of Health. And then we await their response, and then we will get back to whether or not the vaccine will still be considered valid. And following the procedures, we may need to relabel that vaccine just in case it is exposed at different temperatures again. So we'll be giving you those directions. Next slide, please. So the Comirnaty Pfizer BioNTech vaccine comes in multiple doses, and it contains frozen suspension and has no preservative and must be thawed and diluted prior to administration. It's stored in an ultra low temperature freezer of the -90 to -60 for up to 6 months. The date on the vial is actually the manufacturer date, and then that vaccine would expire 6 months from then. But there might be some vials or cartons that would indicate to discard after 6 hours when it's at room temperature. So we want to change that or make you aware that the vaccine is stable for 12 hours at room temperature before you dilute, and as well 12 hours after dilution. So there's a lot of differences with that new stabilizer. So once we put the vaccine out of the ultra low freezer into the fridge at the 2 to 8 degrees, it is allowed to be stored for 10 weeks. Once we take it out for our clinic at room temperature, it can only be stored for 12 hours. However, you can be putting that vaccine back in the fridge, but again, you have to keep track of how long it was at room temperature and when you put it back in the fridge, and then it can only be a total of 12 hours at room temperature. So it's going to be a lot of just tracking. So we want the vaccine to be at room temperature before we dilute it. So we are recommending that it should be out at least 15 minutes when it's stored in the 2 to 8 degrees fridge. Once it's thawed and we reconstitute it with the 0.9% sodium chloride, it can be stored at room temperature of the 2 to 25 degrees Celsius for up to 12 hours. And with most vaccines, we do want you to be limiting the exposure to light, and especially avoiding exposure to direct sunlight and ultraviolet light. And once the vaccine is out of the ultra low freezer, it is not to be frozen again. Next slide, please. So the parents will be able to tell what the pediatric vaccine is. This is the vial of the pediatric 5 to 11 vaccine. It is orange in color, so it has an orange cap and it has an orange label. The 12 plus Pfizer has the purple cap, and shortly after they change some of the labeling, it will have a purple label around it as well. So we know that just looking at the vaccine vial that this is the 5 to 11 age group. So when you look at it, when it's frozen, it will have white to an off-white coloring. And once it's thawed, it might have opaque amorphous particles, which is just no defined shape or form to it. And it once it's thawed, it can be reconstituted, and then it will have a white to off-white suspension with no visible particulates or discoloration. Next slide, please. So this is the mock-up of a carton of the vaccine. So once it's all folded, it's the vaccine will be sitting in there, and once it's diluted, we will have 10 doses that we can take out of that. And we'll just go to the next slide as well. So again, the packaging is orange in color, with borders being orange, the top being orange. There will be 10 doses per vial once it's reconstituted, and we will reconstitute it with the 0.9% sodium chloride that we are using for our 12 plus Pfizer vaccine. And the sodium chloride is a one-time use only, so you will withdraw 1.3 mils of the diluent and add it to the orange top pediatric 5 to 11 vaccine. Okay, next slide, please. Undiluted and unpunctured thaw vials may be stored in the refrigerator between 2 to 8 degrees Celsius for up to 10 weeks. And of course, the orange 5 to 11-year-old community Pfizer vaccine needs to be thawed before dilution. And if the vaccine is removed directly from the ultra low temperature freezer and placed in the fridge, the carton of 10 vials may take up to 4 hours to thaw. So we do want you to be marking when the vaccine is taken out of the freezer and moved to the 2 to 8 degrees Celsius. And if you are taking a vial out of the freezer to room temperature, it needs to sit for 30 minutes before it's diluted. And again, just those comments of anything that's undiluted and unpunctured, thawed vaccines can be stored for up to 12 hours prior to dilution. And it can be taken back into the fridge, but you need to track that time. And then once the vaccine is diluted, it is good for 12 hours at room temperature. And any diluted, reconstituted vaccine that is not used needs to be wasted. So you would report that on the vaccine wastage form. Next slide, please. So again, prior to dilution, the suspension is opaque, amorphous particles. We are going to be taking the vaccine that is at room temperature, diluting it with the 1.3 mils of sterile 0.9% sodium chloride. And even though the vial of the diluent of the sodium chloride has 10 mils in it, we are only taking out that 1.3 mils, and we will discard that sodium chloride diluent after that one use. And then after we withdraw, the vaccine vial will have 10 doses of what we will be providing to each child, which is 0.2 mils. And again, we know that the color of this will be white to off-white, and we want to inspect the vial to make sure that there's no particulates or discoloration. And again, once it's reconstituted, it's good at room temperature for 12 hours. And then we want to make sure that it's protected from light and sunlight and ultraviolet rays. And of course, when we are getting the diluent ready, the vials ready, we're using the aseptic we'll be going through later as well. So similar to what we're using with the pediatric or with the 12 plus Pfizer vaccine, before dilution, we're going to be inverting it gently 10 times and making sure that we're not shaking it, and then inspecting the vial, make sure it doesn't have any particulates in it. And if there were anything that was observed, we would not use it and then fill out one of those product forms, which right now it's going blank. I can't remember what it's called, problem report form. So we will take the diluent of the 0.9% sodium chloride, withdraw 1.3 mils, and then inject that into the orange top 5 to 11-year-old vaccine. Next slide. And to equalize the pressure, we want to withdraw the 1.3 mils of air into the empty diluent syringe so that it is ready. Next slide. And then we're going to gently invert the pediatric permitted 10 times to mix, being careful not to shake the vaccine. And again, you want to take a look at the vaccine to make sure there's no discoloration or any particulate matter. And then once that vaccine is mixed, you want to record the date and the time of the puncture for that. And remember that once it's mixed, it's only good for 12 hours. And now, so again, just those things to note, the differences between the pediatric vaccine and the 12 plus is that once it's moved into the vaccine fridge from the ultra low temperature, it can stay for 10 weeks. And once it's taken from the fridge to room temperature and it's not diluted yet, you can keep it out for 12 hours. And then once it's diluted, it is only good for 12 hours. So I think we've covered that a few times, but we do also have some resources that you can refer to as well, because there's a lot of information passing out. But I will now I will now hand over to Lindsay to discuss the rest of the presentation.
Thank you, Joanne. Hopefully everybody can hear me okay. So like any of the other vaccines that we're giving, we want to ensure that we are receiving informed consent from individuals. So this is a process that provides documentation to support the fact that all risks and benefits of that treatment were explained by the provider and appear to have been understood by the parent, guardian, or caregiver. And it's our responsibility as immunizers to provide information and communicate honestly and effectively with clients, the caregivers, and anyone representing clients regarding the benefits and risks of immunization. and the risks also of remaining unimmunized. So we're going to provide the standard information that we would provide to everyone, the vaccine information sheet, information about COVID-19 disease, benefits of being vaccinated, risks of not being vaccinated, the common side effects that they can expect, possible serious, severe, or unusual adverse events and their frequency, and any contraindications that might exist. Just to note, for this particular age group of 5 to 11, written consent is required, so we do have to have that paper form signed by the caregiver or guardian or parent. We also want to make sure that people have an opportunity to ask questions and confirm that they understand the information we've provided. So there is a consent form for the 5 to 11-year-old group. It would be the same as the children and mature minor consent form that we've been using. So just ensure that you have those printed out and available at your immunizing locations. If we're documenting the immunization into the CQE, the consent needs to be entered electronically as well, and there will be further direction coming from eHealth regarding that. And if we're recording the vaccination directly into Panorama, the consent directive must also be entered. So this is the information sheet from the SHA that was shared out on Tuesday evening and is also available in the Google Drive and on the SHA website that we'll be using to provide information to clients. And these are the screening questions that we're going to go through with everybody. So very similar to the screening questions we've been using with the Pfizer 12+ vaccine, with a couple of additional questions. So we're going to ask if the child is feeling ill today, if their child has had a previous COVID-19 infection, if they have allergies to any components of the vaccine, including polyethylene glycol, if they have a history of myocarditis or pericarditis that's not related to COVID-19 immunization, or that occurred after getting a dose of an mRNA COVID-19 vaccine. And I'll talk a bit more detail about that when I talk about the vaccine contraindications and precautions background document. Does the child have any problems with their immune system, or are they taking any medication or treatment that can affect their immune system? Do they have an autoimmune disease? Have they received monoclonal antibodies or convalescent plasma for prevention or treatment of COVID-19? Have they had a TB skin test, or do they need to have TB blood work done? Do they have a bleeding disorder, or are they taking any medications that could affect blood clotting? Have they ever had multi-inflammatory syndrome unrelated to COVID-19 vaccination? Have they ever felt faint or fainted after a past vaccination or medical procedure? Did the child have any side effects after a previous dose of COVID-19 vaccine? And has the child had a serious reaction to this vaccine or any other vaccine in the past? So we want to just not assume that people coming in the next few weeks will be coming for their first dose of vaccine. I have heard about individuals having taken their children to the US to have the vaccine in the past few weeks. I'm not sure if that's occurred in Saskatchewan, but just be aware that we want to ask the question, even though we're likely going to be seeing people for their first dose. We also want to ensure that if people have symptoms of COVID that could possibly be due to COVID-19, they shouldn't receive the vaccine at this time, and they should call Healthline 811 or talk to the community health nurse about their symptoms and discuss getting tested for COVID. So this is what the screening sheet will look like with the questions. It's a 2-pager, so front and back, if you print it out that way. For contraindications, so the only contraindications are a known severe hypersensitivity to any component of the vaccine and anaphylaxis to a previous dose of COVID-19 mRNA vaccine. And Joanne covered well the tris, which is an additional ingredient in this particular vaccine. For precautions, administration should be postponed in individuals that are suffering from acute severe febrile illness and children with a history of previous COVID-19 infection should wait to receive vaccine until they no longer have acute symptoms or and are no longer infectious to others. So same as we would do with the 12+ age group. So for the vaccine contraindications and precautions background document that has been updated as of November 22nd in regards to myocarditis and or pericarditis, as a precautionary measure due to very rare reports of myocarditis and or pericarditis, children who experience these conditions after the first dose should wait to receive the second dose until more information is available. Children with a history of myocarditis or pericarditis unrelated to vaccine should discuss immunization with their clinical team prior to receiving the vaccine. However, if they are no longer receiving active care, they may receive the vaccine. It is unknown if myocarditis or pericarditis will occur after the lower doses of mRNA. The Pfizer pediatric clinical trials did not have any cases of myocarditis and or pericarditis. Multi-system inflammatory syndrome in children with previous history, vaccination with COVID-19 vaccine should be postponed until clinical recovery has been achieved or until greater than or equal to 90 days since diagnosis, whichever is longer. For monoclonal antibodies, for persons receiving antibody therapies not specific to COVID-19 treatment, such as intravenous immunoglobulin or RhoGAM, they are recommended to receive and or complete a full COVID-19 vaccine series either simultaneously with or at any interval before or after treatment. Immunocompromised individuals should discuss the timing of immunosuppressive therapies with the vaccine with their healthcare provider. For individuals that are being followed by an oncologist for blood and bone marrow stem cell transplant, they must consult their oncology team first. And it's recommended for all others with cancer to discuss with their healthcare provider as well. For autoimmune conditions and disorders, it's recommended to discuss with their primary physician and specialist before immunization to determine appropriate intervals with their current medical treatment. For TB skin testing or TB blood work, receiving the COVID-19 vaccine prior to having all steps of the TB test completed may cause the test to show a false negative result, which means the test negative result, they would test negative, but it would actually be positive. So ensuring that there is at least 4 weeks between having a vaccine and having a TB skin test or the TB blood work done. So just reiterating what Joanne indicated before, it's a 2-dose series administered 8 weeks apart. And she talked about the benefits of the recommended 8-week interval, but the minimum spacing between doses identified by Pfizer is 21 days. Preparation of individual doses, we want to ensure that we're always using aseptic technique. We want to withdraw immediately before use only. We're going to visually inspect each dose in the syringe prior to administering. Verify that we're withdrawing 0.2 mils. There's no particulates or discoloration identified, and we would not administer if we did identify any discoloration or particulates. And we also want to just emphasize that there is no authorization for pooling of vaccine with this vaccine, so do not withdraw contents from several different vials to make a dose of vaccine. This is just to show you the reconstitution and preparation document that the SHA has available on their website. It's also in the Google Drive. There's a variety of different references and resources that you guys will have available, and you can choose to use the ones that you're most comfortable working with. So administration is an intramuscular in the deltoid, which is the preferred site, using a 22 to 25 gauge 1 inch to 1.5 inch length needle, using a 1 cc low dead volume syringe, same as we've been using for the other Pfizer vaccine, and the dosage is 0.2 mils. So landmarking for these younger children is essentially the same. They're just going to have a smaller muscle mass to deal with, but regardless, it still goes into the belly of that deltoid muscle. After immunization, we want to discourage people from prophylactically giving antipyretic analgesics. So If a child requires or a client requires after the fact to for symptom management for pain or fever, then that's okay. But we want to discourage people from taking it prior to try to prevent those things from happening. It doesn't actually rejection pain, and it may decrease the vaccine immunogenicity. We want to advise the parent, caregiver, or guardian that the client needs to wait for at least 15 minutes post-vaccination in the event of an allergic reaction. And also 30 minutes is preferred when there is a specific concern about a possible vaccine reaction. So we want to provide the following information after they're vaccinated. We want to give them the current aftercare sheet for that particular vaccine, give them direction about when to seek medical attention post-immunization, a wallet card for their record of immunization, and if it's their first dose, let them know when they should return for their second dose of vaccine. This is just to show you the aftercare sheet, again, that was updated and is available on the SHA website as well as in the Google Drive, and was sent out with all the resources on Tuesday. So hopefully everyone has them. Reactions following the vaccine. Studies have shown that expected vaccine side effects were well tolerated and resolved within 2 to 3 days. The most common side effects observed were soreness at the injection site and possibly some swelling. Other temporary side effects may include fever, diarrhea, vomiting, fatigue, headache, muscle pain, joint pain, and chills. Also, some local reactions may occur 7 days or more after immunization and include a rash, tenderness, and extensive swelling at the injection site. This is a known reaction that resolves on its own within 7 to 10 days. For documentation, we're going to continue to use the Panorama system for those that are actively using Panorama. Just a reminder that data entry is to be done within 24 hours of vaccine administration. We also can use the COVID quick entry, so CQE, to enter the information. And for those that are unable to enter data at the point of care, for the South Central communities, the ISC Data Entry Hub is available at the email indicated there. And NIFA as well has a data entry team to assist with data entry for those communities that require. In terms of line lists, when you're documenting, they only need to be completed if you're not entering directly into Panorama or CQE. It doesn't need to be done both. You want to ensure that when you do your line list, you have a separate line list for the COVID age 5 to 11 year vaccine, a separate one for the Pfizer 12 plus vaccine, and a separate one for influenza. Every vaccine should have a separate line list when it's being sent in. And I would just like to encourage and reiterate how important it is to make sure that the line lists are completed in full. So all of the information is there, and ensure that it's legible. The data entry folks that are receiving those have to be able to read what's written accurately to be able to enter the information. And if there's any information missing, then they're not able to enter that information for the client. So just please be conscious of that when you're filling them out. Reporting of adverse events following immunization. In general, an AFI is any untoward medical occurrence which follows immunization and which does not necessarily have a causal relationship with the use of a vaccine. The adverse event may be any unfavorable or unintended sign, abnormal laboratory finding, symptom, or disease. The general definition specifies that the event is not necessarily due to the vaccine. We want to ensure that any adverse events that are severe, unusual, or unexpected are reported, and we want to send that completed AFI to the Regional Immunization Coordinator and await further direction from the Medical Health Officer for any future immunizations. And just for review, we do have the Medical Directive and RN Clinical Protocol for Initial Management of Anaphylaxis, the FNIB Guidelines for the Management of Anaphylaxis, and NIFA will also have these documents available. You can reach out to Carrie if you don't have them at your disposal. And this is just to show you an example of the reference cards that were sent out to assist with setting up and organizing your clinics, to just try to keep all of the information straight and make sure you have the right vaccine for the right person at the right time. These will also be printed and laminated and sent out to communities by both ISC and NIFA. I'm going to hand it over to Carrie now to talk to everyone about some important tips for vaccinating children.
Thank you, Lindsay. I'll be completing the last short segment of the presentation. I'd like to acknowledge that many of our nurses in the communities have extensive experience with child health clinics and immunization programs. Just some tips to highlight for vaccinating children. With the pediatric age group, we do take a different approach with the clinic setups. We do use family and school approaches, emphasis on relationship building and psychosocial support. And we also would like to make it accommodating for the children. Vaccinations can be stressful for both children and caregivers. Creating an environment conducive for children will help make immunizations a positive experience. Non-traditional immunizers and those who are not experienced with immunizing children should complete a competency checklist with experienced nurses prior to immunizing the pediatric age group. You can contact one of our team for immunization checklist, myself or Michelle Aller-Johnson on the Indigenous Services side. Immunizers who have questions or concerns about administering to a child should consult an experienced RN before proceeding with vaccination. Next slide. Just some tips for vaccinating children. Be respectful, emphasized with child and caregiver. Acknowledge the child's feelings. Describe what you plan to do. Don't give false reassurance. Answer the child's question. Why do I need a needle? What will happen? Will it hurt? Provide limited, realistic choices and let the child decide. Would you like to use the right or left arm? Would you like to sit or stand? Do you want to sit on your mom or dad, or do you want to go to a private area to get your needle? When the caregiver presents with more than one child, immunize the most anxious child first. Do not have the caregiver restrain the child until you are ready to administer. Manage the time and set limits. If the child cannot calm him or herself down, acknowledge their efforts and offer a rest period. Next slide. Just some distraction techniques that were shared. Coach children to count or squeeze their hand on the caregiver. Coach children to engage in slow, deep breathing, i.e. tell them to blow away the pain during injection. Work with the caregiver to use distraction techniques. Example, singing, counting, doing the alphabet. And also in today's world, the use of iPad, iPhone games for children to play or watch prior and during immunization seems to alleviate the anxiety. Have the TV playing with cartoons in the waiting area. Consider promotional items to give to children. Some other suggestions, your community health staff may have other great ideas to use for the pediatrics. I've heard that the SHA side have had therapy dogs in for the vaccination clinics, and for the upcoming pediatric COVID vaccine clinics, some will have Santa dressed up and offering picture taking. Next slide. Preparation, just to mention, prepare the vaccine out of sight of the child. If the child asks to see the needle, explain that you will show after the procedure. Keeping the syringe and needle out of sight until time to vaccinate. Next slide. Holding techniques, as many of you are familiar with. Child may sit or stand for the vaccine, let them choose. Sit on the caregiver's lap or stand between the caregiver's legs. Ask the child to fully uncover the arm. Instruct and guide caregiver to hold the child so that the deltoid site is clearly visible and the child is firmly restrained to prevent movement during immunization, as safety is the priority. Ensure the child's arm is positioned closest to the caregiver, placed behind the caregiver's back. The other arm is held close to the child's body with caregiver's arm and hand placed over it. Next slide. And landmarking, just a diagram there of the landmarking again, and Lindsay had covered this previously for reference. Next slide. Another reminder, position yourself in a way that will allow quick administration of the vaccine without creating further anxiety. Following vaccine administration, praise the child and caregiver for their efforts and success. And next slide. The next slide contains a video with the school vaccination, the card system Lindsay had shared with us. Lindsay, do you want to try and open that video? It's a short 5-minute video. If there are glitches, we will just exit and have it there for your reference. If you're not able to load the video, Lindsay, we can just go on to the question and discussion period and open the floor to the participants. And Michelle will also be monitoring the chat box for any questions or comments. Again, thank you all for joining the presentation today.
Are you able to see the video on the screen?
I see it now.
Okay, I'll try play it now.
There's no sound on it.
Hi, I'm Angelo, and I'm going to talk to you about making vaccinations easier. Most of us have had needles by the time we've reached middle school. We've had vaccines at the doctor's when we were little, and vaccines at school, too. For many people, it's not a big deal. Many don't even remember getting needles when they were little. But some people feel more pain than others. And for some, vaccinations can hurt. And that pain can cause some people to be afraid. And the fear of pain can last.
When I got my needle, I was so scared and I'm crying. It's just scary.
Not scared? It's when you put happening.
And then when they hold it and you're like, and then you see the big long pointy needle.
Needles help save your life, so being afraid of them is not a good thing. But did you know you can help control how much pain or fear you feel?
It'd be better if you had something to get the pain away.
Here's a trick my brother taught me. You've got some power cards up your sleeve. Here's how you play them. On your turn, that is when you get your needle, you could be dealt pain cards. This is the pain coming from the needle. Think of pain as a signal from your body, like an alarm. It's up to you to stop those alarms with your power cards. You can play any or all of your power cards depending on how you feel. Now, just so you know, no one feels pain and fear exactly the same way. Different people will be dealt different amounts of pain cards. It's an individual thing. That's how come you can play your cards however you want. It depends on how you feel.
And it only take a few seconds. It's more like a pinch.
Yeah. Well, everyone has their own feelings, right?
Most kids don't feel pain at all, and it's not a big deal. But some do. It's normal to be afraid of things that are unusual for you or feel painful. So depending on how you feel, you can play different cards. There's no wrong move. Let's play our first card. C. C is for comfort. Make sure you're comfortable when you get your vaccine. Most people prefer to sit upright when they get a needle because they feel more in control. You can also lie down if you feel dizzy. Let the nurse know. If you feel dizzy, try this to prevent it. Tense your leg and your stomach muscles for around 15 to 20 seconds. Then release the tension back to normal. But make sure you don't tense your arm. Try to keep it loose or jiggly like spaghetti. A is for ask. Knowledge is power. Ask questions. Find out what's going to happen when you get the needle. If you're nervous about it, knowing what to expect and what you can do can help you feel less worried. This is your opportunity to speak up. Let your parents or teacher or the nurse know your preferences. Like, you can ask for privacy if you feel you need that. You can also ask your parents about using a topical anesthetic. This is a medicine that makes the needle hurt less. Your parents can buy topical anesthetics at the pharmacy. Medicines like this can be useful, but did you know your thoughts and actions can control how afraid you are and how much pain you feel? R is for relax. Be calm. This can reduce fear and pain. The more stressed out you are, the more pain you'll feel.
I think you think the pain, you're going to over exaggerate the pain, you're going to be more scared.
Use your self-talk as a pep talk and tell yourself that most people don't feel much pain. And if you do, you can handle it because you can.
The nurse or doctors always say to me, "Can you relax?" And I can't do that.
Some people find it hard to relax. Taking deep belly breaths, as if you're blowing up a balloon in your belly, works really well to make you relax. Rest one hand on your belly. You'll be moving out as you breathe in and in as you breathe out. Do at least 3 times and repeat if you need to. Sometimes it takes me about 10 to 20 breaths to calm down, especially right before I have to do a presentation or something. I noticed my mom does it before her presentations too. If you're not focused on the pain, you don't notice it as much. Which brings us to D. D for distract. Distract yourself. Take your mind off the needle and put it to work thinking of something else. For example, the nurse or someone might talk to you about random stuff, like your favorite movie or other activities.
Oh, sorry, it's already done?
Yes.
Well, that wasn't so bad. Bring something entertaining with you that you can use as a distraction, like a book, a game, music. What's your favorite distraction? Mine's a good novel.
I didn't even notice it happened because I was so distracted.
Sometimes just having your arm rubbed while you get the needle can help distract your brain enough so that you feel less pain.
I felt a little bit of poking, but not much.
The nurse might also suggest you look away from the needle.
When I was little, I used to like turn my head away when I was getting the shot.
My mom can't bear to watch me. She turns her head away.
Some kids don't want to look away. They just want to focus on the needle. That's okay too. Just let the nurse know. So now, all the cards are on the table. You've got the tools to get it done. CARD. 4 simple things that can make a huge difference.
Sometimes they're not very medicine. Really not, but they really do feel it. But
I use these skills and strategies all the time. So can you. If you're helping a friend, you can follow the same instructions just for them. C. Help them feel comfortable. A. Ask them what they want you to do to help. Remember, pain and fear are individual experiences. Help them play theirs. And for R, relax. Be calm and positive. If you're stressed out, others will pick up on it and become stressed out too. Help them with deep breathing. For D, distract them with stuff they like. After the needles are done, Think about what went well and let the nurse know.
It didn't hurt. It's just like a little bug bite, that's all. I like how after we got your needle, we got to evaluate how it felt.
These 4 skills can really help you feel less pain and be less afraid when you have a needle. They'll help you now to manage your pain and feel a lot better. And they'll help you in the future if you ever need to get a needle or other procedure. So the next time you have to bare your arm, remember, you've got power. You've got a card up your sleeve to help.
I used to hate it, but now I'm okay with it.
I use the cream, got it. Each my laptop is a distraction, and I'm just gonna feel the fingers much.
Thank you, Lindsay, and we'll open it to questions and comments.
Hi, Carrie, it's Jamie. I just have a little question about this 12-hour at room temperature. So if I took out a vaccine from the fridge for 8 hours, didn't use it, put it back in the fridge, is it a cumulative 12 hours? So the next day I can take it out, but only for 4? Is that what we're trying to say? Or?
Hi, Jamie, it's Joanne.
Hi, Joanne.
Hi, the vaccine can be only 12 hours total.
Okay.
So if you did put it in the fridge after, that 8-hour day, it just needs to be discarded. Right? Because unless you're going to work 12-hour days or 24 hours, I guess.
No. Okay, so say I took it out today for 8 hours, returned
At room
it to
temperature.
yes, returned it to the fridge. Tomorrow, can I take it out for 4 hours?
Yeah.
So after 4 hours, then discard the remainder of the vial.
Right.
Gotcha. Thank you.
That's just going to be a lot more things to consider, especially if you're doing a family clinic, and we've got Pfizer 12 plus is only good for that 2 hours before you dilute it, 6 hours after. You've got Moderna, and it's just some things to consider. Yeah, but it can be out only for 12 hours total.
Okay, gotcha.
Hi.
Thank you.
Hello, can you hear me?
Hi, yeah.
Hi, my name is Laura. I'm from Larange, from Lac La Ronge Indian Band Health Services. I have a question in regards to having to dilute it. In the SIMS manual on chapter 10 of page 4 of the biological products, it says that vials at room temperature must be diluted within 3 hours. So I just wanted to ask that.
Oh. Let me check. So that's when you're taking it out. I haven't memorized my SIM manual yet. And you're referring just to the pediatric?
Yeah, yeah, she is. This is Robin. I'm in the same room as her. So she was in the SIMS manual. It says the vials may be thawed in the refrigerator temperature. Thaw for 30 minutes at room temperature. Vials at room temperature must be diluted within 3 hours. And this is just for the pediatric Pfizer vaccine.
I'm just opening the SIM as well. This is Lindsay. I have the vaccine product monograph open, and the product monograph indicates 12 hours that it can be at room temperature prior to dilution, and 12 hours after dilution. And when I participated in the
training
online webinar with Pfizer, they indicated it's a total of 24 hours, so it can be out 12 hours undiluted and 12 hours diluted. So I'm just
Yeah, I've got it on, I'm on the sim manual and it does say to only have it for 30 minutes. So we'll have to contact the ministry about this because when you look at the COVID-19 vaccine, let me just see where I have that, under the Pfizer information, it is different. So
Okay.
very helpful for us to try to figure out what we're doing when all our resources seem to be a little bit different. And that's unfortunate, but we'll get that sorted out for sure. But thank you for mentioning that.
Okay, thank you.
Hi, it's Jeannie again. Sorry.
Yeah.
I was just going to ask you this transporting on
Gravel road?
gravel roads.
Yes.
Like, are we going to be asked to only take, like in the wintertime, only take highway roads or stay
Well,
off the
that's
grid? Or...
pretty much impossible, I think, because I've driven on many of those roads. I have a call out to Pfizer directly to the company and asked that question. They just have not gotten back to me. Carrie, can you receive some information from Larissa? Would you be able to answer that? We have been transporting Pfizer 12 plus already. You just, don't want to be, I would assume that it's going to be off-roading, right? You're not going to want to go down a road that's just like a path into the bush, as opposed to one of our hopefully maintained gravel roads. But I don't know, Carrie, if you've got any information about that.
Joanne?
For the transport, it is preferred that it's transported in the ultra frozen state, the -60 to -90. But the option B is transporting between in the refrigerator temperature 2 to 8 degrees. So in circumstances where it is required to transport once it's thawed, it is acceptable to transport it, and there is no limitation on the number of hours that it is transported.
Joanne, it's Colleen. May I say something?
Oh, yeah.
So, because Jamie's mine. So in the central area, we will be transporting only ultra frozen. Where in the past we've had nurses sort of popping in and picking up vaccine and taking it out because it can go at -20. This will be different. We have a different system set up. So we've got kind of route set up and we'll just be transporting the vaccine in the ultra low.
In the ultra low, just
Yeah.
because of those same comments that are on the 12 plus, when you read the work standard, it does talk about, not transporting it and limiting the vibration and that kind of thing. So I haven't gotten anything back from the company yet, but that would be sort of best practice to do, is transport it in the ultra low frozen state, and then thaw it once it's there. And that again is going to be just the logistics for each community, and depending on where you've got the vaccine. Like if you don't have to travel 10 miles to your clinic, over the gravel roads. So if that's possible, to get that transported in the ultra low, that's the ideal.
Hi, it's Laura again.
Okay.
Carrie, I was just wondering, because we don't have that, is it possible for us to get that? Especially if we're traveling out to Hall Lake, Grandmother's Bay, like we're gonna need that.
I could look at seeing if there was one available from our suppliers, the ultra low freezer, but as mentioned, like that's the preferred method to our hub sites, you will be receiving them in ultra low temperatures. But once it is refrigerated, or if it's not available, it is acceptable to transport in the 2 to 8 degrees. But knowing that it's already counted on your 7 weeks or 70 days, it's not ideal, but it is acceptable to transport in the 2 to 8 degrees. But you can send me an email requesting that, and I will follow up and see if we can get Laronja ultra low.
Okay, thank you.
This is Lindsay.
No.
Can I just follow up for clarification on the question about the 12 hours whoever asked the question about having the vaccine out for 8 hours and putting it back in the fridge and taking it out for 4 hours the next day. Were you referring to vaccine that's diluted or undiluted?
Undiluted.
I just want to make sure, because once it's diluted, it's 12 hours, regardless of if you're storing it anywhere from 2 to 25 degrees.
That's right. But if it's undiluted, we can return. I just needed to know that if it was like the time doesn't start all over again the next day. So it's a 12-hour all in, right?
Yep.
So 8 hours.
That's right.
8 hours out at room temperature today, and take it out tomorrow, dilute it in the regular time amount, 15 minutes, but then it's only good for 4.
Yeah.
Am I right?
Yep. So
Okay.
what? I don't
No.
like.
So
Okay.
Joanne, I think we should clarify that, because my understanding from Pfizer was that it would be 24 hours total. So 12 hours undiluted and then another 12 hours diluted. So I think we should clarify that when you talk to Pfizer, Joanne.
Sure.
Okay, thank you.
And I'm just looking at the work standard for so many of them. Vaccine storage and handling and cold chain break procedures for COVID-19 vaccine, which is on the COVID-19 manual. And when you read the 5 to 11 vaccine, it's all separated, and I'm in the wrong section. It does talk purple cap, orange cap. Undiluted and unpunctured at 2 to 8 for 10 weeks. Vials thawed at room temperature may be returned to the refrigerator for storage if necessary, but the total time at room temperature must be tracked to ensure the vial stays within the 12 hours at room temperature limit.
Okay, thank you. That clarifies. Thank you.
That clarifies Jamie's question, right? So that it would be cumulative time.
Right. Perfect.
So if it was out for 8 hours at room temperature and it was not punctured, not diluted, you can put it back, and the next day you can use it for another 4.
Okay, perfect. Thank you.
That's how I interpret this sentence. I don't know if everyone else has the same interpretation. And then after it's been diluted, it's only out for 12 hours. And then after that 8-hour day, then you would discard it. And again, remembering that the vial and the cartons may have states on that vial that it must be discarded within hours, although we are looking at the product monograph, which is telling us that it is 12 hours after dilution. So there is discrepancy between the SIM manual and the work standard. So I will email the province and just get them to clarify that. Send out a new SIM update.
Hi there, it's Michelle.
I just wanted to let you know that under the storage and handling guidelines for the Moderna or Pfizer, sorry, 5 to 11, it does actually say prior to dilution, thawed unopened vials can be stored in the refrigerator at 2 to 8 degrees for up to 10 weeks or at room temperature for no more than 12 hours. Do not refreeze any thawed vials. After thawing and mixing the 1.3 mils 0.9% sodium chloride diluent, the vaccine can be stored between 2 to 25 degrees for up to 12 hours.
So you're reading that off the sim?
Yes.
Because where I found it, it was talking about that 3 hours.
Yeah, so there's a discrepancy. So under storage and handling guidelines, it's slightly different as than in the other section.
We'll have to just confirm all of this and then send a confirmation email to everyone so that we know that we have it clear for everybody.
Oh, and there also is a discrepancy from that to what the company is saying. So, yeah. So you're looking at two different things when you're looking at the SIM manual. You're looking at oh, so much stuff. Preparation and reconstitution, and then a different section which is storage. So I can see where that can get quite confusing. But we'll get it all sorted out and send out another clarification email like Lindsay just did. Great questions, thank you. One comment I just wanted to make in terms of filling out the panorama or the registration line lists. In that section where it says consent, all you need to write in there is parent, guardian, mature minor. You don't have to give anyone's name because we already have assigned consent that will be housed in your clinic.
Okay, sorry, it's just me one more time. I just want to make sure I got this straight.
Yeah.
I had a quick question about this consent. Is it different from the 5 to 11-year-olds in the aspect of, does it have to be written consent? Because sometimes we do get consent over the phone when somebody else brings an under 17 in. Is that any different from with the pediatrics?
Yeah. That would be, and Lindsay, you might have to help me on that because I don't have my NPEG memorized. I believe there is this section. Let me just get to the right. There is the ability to have a, just gotta open it up. If there is a telephone consent on the back of the consent. So what we're using is a consent for COVID-19, which should be dated October 2020.
Okay, thank you for stopping in.
That would be for children the 5 to 17.
Do you want to repeat what you said, Joanne? You kind of cut out a little bit.
Oh, I cut out? Okay. So the consent that we are using, the written consent, would be for the South Central ISC is dated October 2021. And it is the consent for COVID-19 for children. So we do have our policy to have consent until they're 16. So that consent would be used for that age group. And we can use the mature minor for the 16 to 17 years of age. But we also have a section to get telephone consent for 5 to 17.
Okay, perfect. Thank you.
Hi, this is Odette from Wichita. I have a question.
Mhm.
On page 13 of the learning package, it states 15 minutes out of the fridge will take it to room temperature, and then the vaccine can be reconstituted. Then on page 35, the SHA, it says, remove a thawed vial of the vaccine from the refrigerator and allow it to come to room temperature. This takes 30 minutes. So when can we reconstitute it? After 15 or 30?
Lindsay, I'm not sure, did you hear when you went through that training with Pfizer?
I did. And the reason that the discrepancy is there, and I apologize for that, is because the Pfizer, when I attended the webinar with Pfizer, they indicated about 15 minutes for it to come to room temperature. And they just said, when it's not cold to touch, then we can reconstitute. And then when the documentation came out, it was written as 30 minutes. So if we go with 30 minutes, we know that it's definitely going to be at room temperature. But what the company said was about 15 minutes should bring one vial to room temperature. But of course, there's discrepancies in room temperature in different locations as well. So it should not be cold to touch when you touch the vial for it to be reconstituted.
Right.
Okay, thanks.
And I've also, I'm reading on the work standard that if you take a frozen vial out to room temperature, that it would take 30 minutes to thaw at room temperature. So that's possibly where it's coming from as well. Is that 30 minutes? But I think 15 minutes to 30 minutes, and making sure that, you know, it's not cool to touch is a good kind of vague guideline.
Yeah, thanks.
There's a question in the chat in regards to consents. It says in CQE, can the consent be entered for both the first and second vaccines? If so, the consent expiration date would be entered 8 weeks later.
Lindsay, can I have you answer that, just because my practice has been different because I haven't worked. I normally would say that once the consent is signed, a written one, that it would be for the completion of the series, which is what it indicates actually on the consent form. So you wouldn't need to get another consent. Yes, please. But if you are not sure, if you don't have that consent, because maybe they went to a different area, then you know, it's not going to hurt to get another signed consent. But if you know the family and they have the one signed consent, then that's all that's required.
That's my understanding as well, Joanne, that when they sign once to consent, they're consenting to the series of that vaccine. However, if it's different in CQE, I unfortunately can't answer that question because I haven't had to do that. So if somebody on the line has done that consent in CQE and can answer that, it would be helpful.
Well, if we're looking at Panorama, all you have to do is enter it in one time, right? So CQ is just a data entry into Panorama, so it would only need to be entered one time, but I will look into that. And I have to send out some information about CQE anyway, so that was a great question.
For adults, it's 12 hours now. Mobile, is it still 6?
Oh, it's still 6. So it's two hours. It's still the same for the adults. 2 hours before dilution, and then the 6 after. And that's just because the the different stabilizer in the 5 to 11 vaccine. So there is that nurses resource that has information for all 3 of the vaccines that we are currently using in our communities that you can refer to, because as we know, it's all different. So it's handy just to have that comparison chart with you.
It's the COVID-19 mRNA quick guide, and that was emailed out this week already.
I think we well, probably it's after 12 according to my computer. And if you do have any further questions, because there are a lot of information was passed, there seems to be some confusing information between the SIM and the work standards. So please reach out to one of us, either myself, Joanne Bryant, Carrie, and then we will look into getting the answers for you. So please do not hesitate to call. That's why we're here, just to hopefully make your process a little bit easier. And even if it's just a call to double check, it's always better to double check than just to go ahead. So thank you for attending this morning. And have a great day.
Thanks, everyone. And I just indicated that we will follow up with an email. So have a great day, everyone.